patient walked in was literally using a broomstick, and they walked out on their own power. And it wasn't with a pill, it was with this and these.
According to World Health Organization, more than 600 million people go through back pain.
Low back pain is endemic. My responsibility is to teach them to take better care of themselves.
What are the 3 exercises that you would typically recommend?
Bird dog is one of them.
Does swimming help?
Swimming I love as an exercise.
What about walking?
Get up and move around, 20 to 30-minute walks per day.
What is the correct sitting posture?
We should be sitting in a more upright or neutral position.
So about 13 years ago, I fell on a squash court and cracked my back. I had a slip disc.
Discs don't actually slip. They tear, they herniate, or they rupture.
So if I visit you, you'll just press some buttons and I'll be okay, right? Just on a lighter note, do you end up pressing the wrong buttons sometimes? One piece of advice in terms of taking care of your back. We all want to grow, we all want to think bigger, and we all want to reach our full potential. But here's the thing. If our bodies are not aligned, our minds are not going to support us. It's that simple. And this is where we hold ourselves back. We have bad postures. We don't know how to sit. We don't know how to stand. We don't know how to lie down. And this is where the problems occur in our bodies. This is the reason that I wanted to sit with Dr. Gerry, to understand these issues and to help us fix our body pain, to help us align our bodies better. And this is where, once we've reached this level, this is where the growth happens. This is where we start optimizing our mental health as well. This episode is full of value. You cannot avoid it because we all face back issues. We all face pain at some point in our bodies. Let's understand our bodies better. Let's grow better. Let's take care of our health. Let's dive in. Thank you so much, Dr. Gerry, for being with me today.
Thanks for inviting me, Tariq. It's a pleasure.
Thank you. Very good morning. We've had a billiards game and it's full of fun, actually, sitting right here.
Yes, it was a unique opportunity. I've never seen a podcast like this with a billiards table. Got to play an enjoyable game of 9-ball, and you bested me.
Oh, I didn't want to, but it just happened to be that way. Well, thank you. I'm glad that you enjoyed the billiards. First of all, thank you for correcting my posture to start with. I would like to start with telling a personal story about myself, how I went through my back pain and where I am at the moment.
Sure.
So about 13 years ago, around 2012, I had a slip disc. I fell on a squash court playing squash. I just fell on my bum and cracked my back. And it was quite serious, by the way. I couldn't walk straight for about 6 months. I used to limp. People used to ask me, what happened to you, Tariq? It was quite serious. I mean, we had done the MRI, X-rays and all that, Doctors had diagnosed that I needed to do immediate surgery. One of the doctors even said that I have to have the surgery within the next 3 days. It was that serious. I went around Dubai, different hospitals, panicking. And most of them said that I had to have the surgery. I went back to Pakistan to one of the hospitals. Doctor there was he showed a little mercy. He said, it's fine, you can recover, just do swimming. I used to swim before that as well. So I swam for about a month and it got fixed. Now, 13 years down the line now, I happened to join a public gym. I have a gym at home as well, but the moment I joined a public gym, I was under a different kind of a pressure, compete with other people, in a group. So I ended up having a wrong posture and hurting my back again. Now I'm going through back pain at the moment. I've done physiotherapies and all that, but I'm in the process of fixing it. Connecting the dots, there's a huge amount of world population which goes through similar back pain. I've done little research. Now, according to World Health Organization, about more than 600 million people go through back pain at any given point in time around the world. Now, my question to you is, how does a chiropractor come in?
Great question. So as you rightly pointed out, low back pain is endemic. It is something that has plagued the healthcare system, both from a treatment standpoint and a financial standpoint, because it represents a huge burden on the working population. As we talked about before, low back pain is one of the major leading causes of missed days from work, second to the common cold. It is a very expensive and very prevalent problem in the United States as well as worldwide. And what chiropractic offers is the drugless, holistic approach to tackling this huge problem. I like to akin myself to a mechanic. So the body's a machine, like a car. And most of the time, the car can be fixed rather than scrapped, okay, or replaced. And that's my role in the healthcare system. And in the 35 years that I've been in practice, we've helped thousands, tens of thousands of patients recover and be able to manage their conditions more effectively. And that's really, really important point that I want to make is a doctor, first and foremost, is a teacher, okay? And my responsibility to my patients is to assist them to overcome from their health conditions, but also how to teach them to take better care of themselves. Because most of the time, they won't need me. I'll be there if there's a problem that they can't handle, but most of the time, they need to take care of themselves. Just like most of the time, you take care of yourselves when you have a cold.
So how does a chiropractor, in terms of the fixing, how does chiropractor come into the picture to start with? And of course, we'll talk about the self-care, of course, but I just want to understand the concept here first.
Sure. So what chiropractic does, we look at the frame, the structure, the function. I akin ourselves to structural engineers. We utilize techniques to address mobility, functional disturbances, neurophysiological syndromes. For example, if a patient has numbness and tingling radiating down their arm or their legs, to take the pressure off the nerves, to allow the body the chance to better heal itself, to put it in a more optimal functional relationship through the use of manual techniques, through the use of instrumentation, through the use of corrective exercises, functional exercises, to enable the body that chance to heal itself.
So you make cracks in bodies, I guess.
Yeah, so that word crack, so we call that a cavitation, okay? And that crack, studies have shown that doesn't really mean much, okay? The sound, although patients like or may like to hear it, that cavitation is just bubbles in the joints being formed. It makes a noise. Its significance, whether you hear it or not, doesn't mean much. What does mean much is the reduction of pain, the reset of the neural reflex, and the return of normal ranges of motion.
Right. Obviously, you're aware of certain points in the body where you press the buttons, basically, and then they get fixed on their own, right?
Yeah. So what chiropractors specialize in is the relationship of the nervous system and the spine, okay? The spine houses the central nervous system, the spinal cord, okay? The brain and the spinal cord make up the central nervous system. And chiropractic seeks to restore the normal relationship or a more normalized relationship between the nervous system and the spine and function. So when pressure is put on a nerve, the nerve malfunctions. It doesn't send the correct signal.
Right. The pressure comes from, a lot of the times it is from a slip disc, I believe. I mean, my own story is that of a slip disc, right? I mean, a lot of people don't actually understand what is a slip disc. Do you want to explain
Sure.
this a little?
So that's a great question. So slip disc is a misnomer. Discs don't actually slip. They
That's right.
bulge, they tear, they herniate, or they rupture. So the best analogy I can give you is a car tire. Let's say you're driving on the road and you get out of the car and you notice the tire has a bulge, okay? So let's say that bulge has a tear in it or a crack in it. Now that crack, that's a herniation. And that herniation can increase in size where it starts to press on the nerves, okay? Or you can get a blowout and that tire is no longer drivable. And that's akin to a disc rupture.
Right.
Yeah.
And the nerve that you're referring to actually runs throughout the body from the neck to the bottom of your foot, right?
Yeah, so there are 31 pairs of spinal nerves, okay? And they come from the neck all the way down until your tailbone, okay? And when you have pressure on the nerves, they can cause dysfunction. Anything from pain to numbness, tingling, to a loss of function, an inability to grip a pen, difficulty walking, trouble raising your leg. So depending on the amount of pressure that's put on the nerve, it can range from just pain to something quite serious.
Right. So this is the most common cause of back pain, if I understand.
No, discs are not the most common cause of back pain. The most common cause of back pain is just simple mechanical wear, okay? That makes up the majority of back and neck pain. Overuse, misuse, unaccustomed use. So what you were talking about, going to the gym. So going to the gym and practicing maybe a different routine for the first time, yeah, you get a little sore. Maybe you overdid it. Maybe you did it the wrong way. And now you have pain. That mechanical wear and tear or mechanical overuse, misuse, or unaccustomed use is far more common than a slip disc.
But that would be something to do with the muscles, I believe, right?
Okay.
If there is a pain in the back, it has either to do with the muscles or with the sciatic nerve that you're talking about.
Great question. Yeah. So remember that there's a lot of hardware that goes there, right? Yeah. There's muscles, joints, ligaments, and it's very hard to affect one without affecting the other, right? So yeah, you can have simple muscle soreness, which maybe goes away after a day or two after the gym, or you can have something more like joint dysfunction, which it doesn't clear after a day or two or 4 days or 5 days or a week. It hangs out. Now we're into something a little bit different because muscles usually go away after a few days, that initial soreness, right? But something that hangs out or impedes the ability to move or function properly, that's usually something a little bit more than muscular.
In my case, it's been nearly 3 months now.
Yeah.
I haven't been able to recover. Yeah. I've been applying some creams and taking some anti-inflammatory drugs, but whenever I stop, the pain comes back.
Yeah. So a good rule of thumb that I tell my patients is, if it's gone about a month and it hasn't gone away, that's generally a rule of thumb that it should be looked at, because upwards to 80 to 90% of simple back pain usually self-resolves within the first 3 to 4 weeks, on its own. Yeah,
that's right. So you're saying potentially it could be related to the disc, as they call it.
It could be something a little bit more serious than muscular, correct.
When exactly should a patient come and see a chiropractic?
Great. So in my particular practice, I treat a variety of musculoskeletal complaints, back pain, neck pain, things like that. So typically, it is a good idea to see a chiropractor when you cannot get those symptoms to resolve over a couple of week period. As we talked about before, 90% of back pain goes away in 4 weeks, okay? At least 60 to 70% goes away after 2 weeks, all right? So if that back or neck pain is still hanging out, it's a pretty good idea to come see me, okay? And remember, if you're interested in treating the overall cause of the back pain as opposed to symptoms, meaning you could pop a pill, take an anti-inflammatory, and treat the symptoms, and that will make the pain go away, but it doesn't necessarily make the problem go away, particularly if that symptoms are reoccurring on a regular basis. Generally, back pain happens once, twice, or 3 times a year, okay? If it's happening more than 3 times a year, it should be looked at.
Yeah, I can relate to that. I mean, I usually have some sort of a muscular spasm after every couple of years. So yeah, I mean, this time it's not going away. The pain is not going away. It's been, I think, nearly 3 months now. I definitely need to come and see you. What is your most favorite adjustment?
My most favorite adjustment is the one that gets the patient back on track. I use a variety of techniques.
Yeah.
So I am not akin to any particular technique. Being in practice for 35 years, I use at least 6 to a dozen different type of techniques. I'm not beholden to any. I'm a jack of all trades.
Yeah. So if I visit you, you'll just press some buttons and I'll be okay, right?
Well, the first thing we're going to do is we're going to take a detailed history.
Okay.
We'll do a mechanical evaluation, see what's going on, because my job is to locate what the source of or the etiology of the pain is, where it's coming from, and then how best to address it, whether that be through my own care or the addition of some specialized testing, or even potentially the use of some of the other specialists that I work with. Because, in my career of 35 years, I've worked with a number of specialists. I've actually in the United States been on a hospital staff. No one healthcare practitioner has all the answers. We form as a team and we work in the best interest of getting that patient well.
Right. Normally, how many visits are required? Of course, you will do an assessment. But in my understanding, I mean, back home, we have some chiropractors, and the stories go this way, that they visit the chiropractor and then, they do some manipulation and off you go. You're running like a rabbit after that.
Yeah.
Are those stories true?
Great question. So, yeah, I mean, there are patients that need one visit and they're jumping off of walls again, okay? What I generally try to do with patients is taper their expectations based upon their examination findings. Certainly something that's been going on 6, 8, 10 weeks. Can it go away after one visit? Yeah, it's possible. Is it likely? Probably not. Probably it's going to take a little bit more time, a little bit more treatment to get that condition under control.
Right. So let's divide it into percentage. I mean, what is the percentage of your patients that get their issues fixed in the first visit?
Yeah, okay. So you're talking less than 5 or 6%. It's very uncommon that a patient who comes in and needs to visit a doctor complaining of back pain is going to, be instantaneously stable and cured, okay?
Right.
Resolution of complaints go through different phases, okay? Number 1 is the acute or intensive phase. Acute pain, right? And that generally could take anywhere from the initial 7 to 10 days to start to resolve. And then we move into the stabilization phase, okay? And what I like to talk with patients about is, for example, when you go to the gym, you're not going to see results in the gym after one session, yeah? You're going to be mainly sore, right?
Yes.
You don't start to see those results in the gym maybe not until 3 or 4 weeks, and you say, oh, well, this is starting to work, okay? So the majority of patients, what a good rule of thumb that I tell patients is, however long it's been going on, you should kind of taper your expectations to it's going to take that long to resolve. What I generally tell patients is we're looking for a minimum of 30 to 50% improvement within the first couple of weeks. If we see that, that means we're on the right track.
Right.
If we don't see that, that may mean we need to look in a different direction or do some additional testing to find out if there's something additional going on.
Right. So how many sessions, let's say if someone visits you and gets 5 sessions, how many people get their issues fixed?
Yeah, a good majority start to not only feel better, but stay better in those 5 or 6 sessions.
Right.
That's a good majority of patients.
Just on a lighter note, do you end up pressing the wrong buttons sometimes?
Yeah, I mean, great question. Yeah, so with any healthcare practitioner, it's my obligation to explain to the patient what's wrong with them, their diagnosis, how we're going to treat it, what the implications of that treatment are going to be. And the majority of times, when I tell patients all this, there's 3 ways a patient can react after their first treatment. Number 1, instant relief. They can feel a lot better immediately. Number 2, they can feel exactly the same. Number 3, they can feel a little sore. All 3 are normal. Depending on how they react, it lets us know how to taper the treatment frequency, and the expectations. But certainly, like any healthcare practitioner, it's my obligation to explain to the patient both the positive, negative, and risks and alternatives to the care.
Right. Now, we're talking about the back pain. There's neck pain as well. And according to the World Health Organization, more than 200 million people suffer from the neck pain. Right? Is that something you help with as well, I guess?
So what I treat is mainly a variety of musculoskeletal complaints. Anything from sciatica, like you talked about, low back pain, spinal stenosis, neck pain, upper back pain, radiculopathy. So I see from soup to nuts a variety of musculoskeletal complaints.
Right. So if you were to categorize those pains, so we have lower back pain, the neck pain, which other pains do you look after?
So we treat headaches, jaw pain, TMJ, upper back pain, elbow pain, hip pain. Yeah, so
knees as well?
Yeah, knees as well.
Okay.
So in my training, I have a subspecialty in orthopedics. So I treat a variety of neuromusculoskeletal complaints. It's very common. Again, going back to that analogy of the car, the mechanic treats all the different parts of the car. Yeah, I treat all the different parts of the body as far as from a musculoskeletal standpoint.
Right. So you talked about this self-care, of course. I mean, I understand that has to do with the exercises or the lifestyle or your postures and what have you. Let's talk about the exercises. What are the 3 exercises that you would typically recommend anyone visiting you?
So for lower back pain, typically we start off with the McGill Big 3, okay?
Right.
And these were developed from Dr. McGill, who's a well-known in the back care community. And a very, very common example is called bird dog, okay? So bird dog is a very typical exercise for basic stabilization of the lower back. And that's something we start to introduce to the patient, usually after their first or second visit. Because the big thing, Tariq, about back pain is years and years ago, we used to send patients to go home and go to bed. Do you have back pain? Go to bed. Yeah, stay in bed for 2 weeks. And we found out through research that that's wrong, okay? The body is a machine. It's meant to move. When the body stops moving, the body breaks down and has bad things happen. So for example, in an elderly patient, God forbid, something happens and they catch pneumonia and they go in bed. And stasis starts to develop and their lungs start to fill up. And bad things happen when patients stop moving. So in lower back pain, light activity to tolerance is always the best course, okay? Because the body was meant to move, not to stay in rest.
Right. If you can just simplify these exercises for our audience, if you can just implement them in their lifestyle on the go, just 3 exercises.
Yeah. So I would encourage everybody, go to Dr. Google. McGill Big 3. Bird dog is one of them, okay? That bird dog exercise is the patient is on all fours, and what they do is they utilize their arms and their legs. It's very difficult. We'll get on the pool table and we'll do that. They utilize their arms and legs in a alternating pattern to develop that stabilization throughout their lower back. That's one of the very, very simple exercises that we start off with lower back.
Right.
Yep.
Okay. Right. Does swimming help?
Swimming I love as an exercise, okay? The buoyancy of the water is excellent. It negates the weight. And even for patients who don't swim, I encourage them to get into the pool, walk around in the pool. Again, that buoyancy of the water supports the weight. It negates the weight on the frame. I often ask them to get little floaties and try to start paddling their legs in an upright position to, again, encourage getting that inflammation out of the body. That motion will help, that movement will help to get that inflammation out of the body.
Beautiful. I swim a lot. Yeah. I'll continue with that. What about walking? I was told that you should walk.
Yeah, walking is an excellent aerobic, low-impact exercise. One of the things that I encourage patients to do who come in with acute low back pain is get out and do 2 20 to 30-minute walks per day. Get up and move around to alternate between a restful position and to get up and move around. Because again, we don't want that patient to stay in bed, okay? I want them up and moving around, and I like them to avoid sitting or driving or riding in the car for as much as possible if that patient is having acute back pain, because sitting increases the pressure on the spine about 3 times that of lying down, okay? And about 1.5 times that of standing.
Yes, I need to get the office treadmill now. Certainly, I need to be walking here next to the billiards table all day. I really think I've been planning. I think we have the space here to fit in one small treadmill. That is great. What about hanging? I've been told that, hanging helps the back as well.
So distraction, where you separate those joint components or hang from a bar, that can be helpful, provided there's not significant damage to the ligaments or the muscles. Because, I have a lot of patients ask me, well, I have back pain. Should I go out and do exercise? Remember, if you have a muscle injury or even a sprain, and let's categorize that by strain and sprain. Strain is muscle and sprain is ligament. And the difference between muscle and ligaments is this. Muscles move bones. They attach to bones and they make muscles move, like the muscles in my arm make my arm move, okay? Ligaments hold the joints together. So if you have a strain or a sprain, that's a tear, okay? If you overstretch a tear, a small tear can become a larger tear. So that's sometimes why overstretching a muscle or a ligament isn't necessarily beneficial, okay? And that's why when I tell patients, I want to go back to the gym right away. Well, if the house is on fire, it's time to call the fire department. It's not time to call the carpenter, okay? When we build muscle, we create micro trauma, and that's how muscles get stronger and build. But when we have an injury, we don't want to necessarily create more trauma until that muscle or that ligament starts to heal.
One thing I've been thinking about myself, in terms of weight management, fairly okay with my weight, and my abdominal muscles have been strong for the last 4 or 5 years. I don't have 6 packs at the moment, but I used to. Now, I always think that I have decently strong abdominal muscles and I should not be getting back pain. I'm not able to figure out why back pain is something that I'm suffering from, because I have decent muscles in the abdomen.
Great.
Abdomen.
So let's talk about that, all right? So right away, I clued in on what you said, 6-pack, 8-pack, 12-pack. So that refers to what I call the show muscles, okay? The rectus abdominis, okay? The rectus abdominis is the least important abdominal muscle for lower back stability. More importantly are the oblique musculatures, okay? Wow. And the oblique musculatures are directly connected to the stability of the lower back because they support the spine from the sides.
So these are the side muscles.
Exactly. So what I like to recommend to patients is planking, but most patients do a lot of front planking, which supports the rectus abdominis muscles, as opposed to side planking or oblique planking, which are more for the stability muscles, the obliquus abdominis muscles. Yeah.
So I should look at the sides, not the front, the show muscles.
The front is important, but less important than the sides. So when we evaluate a patient in the office, we not only test their front planking, we test their side planking, okay? And more often than not, we find that the patient has much more stamina in the front plank than they do in their side planking.
Yeah. What about people who are overweight?
Yeah. So this is a real problem. So it's a challenge for patients. First, we have to get them to reduce their weight, and then we need to get them to start to strengthen up their abdominal muscles. So in a patient who has excessive body weight, we'll start them on something to increase their aerobic activity. And one of the best things that I think, you already mentioned swimming. I think that's a great overall exercise for a patient who has too much body weight. Why? Because that water negates that body weight, okay, and helps support the frame from an abnormally stressful position, as opposed to something that's higher impact and more trauma on the spine with the excessive weight.
Certainly, for myself, swimming is the way forward. Of course, I need to take care of the walking and what have you. Now, sitting, we sit all day in office. I mean, according to research studies, just by sitting, doing desk work increases your risk of earlier death by 16%. There could be various reasons attached to this, but one of the reasons could be, unhealthy posture, could be related to, the stress levels and all that. What is the correct sitting posture?
Well, it's great that you mentioned this. And again, what you said tied into exactly what we talked about just a few minutes ago, is the more sedentary or lack of motion in a organism that's meant to move, the bad things happen, right? So when we started off, we were all hunter-gatherers, right? Yeah, and that hunter-gatherer mechanism was meant for motion, okay? Either going after food or running away from becoming food, right? So when we stop moving, bad things happen. So as far as sitting, I like to recommend to patients that you take frequent breaks. So in a typical 8 or 10 hour workday, you should be getting up every 45 minutes, 50 minutes of the hour, readjusting your posture, taking a walk, getting some hydration into the spine, and readjusting your posture. And as far as the best way to sit, you need an ergonomic setup, which is your environment where you're in a more neutral position. So a lot of patients sit in that forward posture, hunched over position, where we should be sitting in a more upright or neutral position.
You mean 90 degree?
Yeah, feet on the ground, okay? Thighs and legs at 90-degree angles.
Okay,
neutral spine.
Myself again now.
Yeah, neutral spine. It's often nice to, if the chair doesn't have a lumbar cushion or a support cushion, to put a little bit of extension into your spine. Bring those shoulders back. The monitor, that top of that monitor should be at eye level or a little bit lower, and you're looking straight on. And then again, if you're working at a desk or a laptop or keyboard, you want the arm and the elbows at that 90-degree angles and straight on, okay? And a lot of people work at dual stations or even tri-stations where their heads are constantly shifted. We want to have it as neutral a position as possible, straight on with the work. And then if you're inputting information, that information that you're inputting should be at eye level as opposed to that chronic repetitive flexion. Remember, we talked about the way things happen in injury: overuse, misuse, unaccustomed use, okay? It's like that machine that breaks down. It works too hard, it works too much, or it's doing work that it doesn't normally do.
Right. So am I sitting in the right posture now?
Yeah, that's a better position than you were sitting with before. Yeah.
Okay, great, Maz. Please remind me next time. Yes, absolutely. You need to correct yourself as well. Thank you, doctor. This is really, really
welcome.
helpful. I think because I'm already suffering from back pain, I can't make it worse. I mean, by just having the wrong posture. Are these chairs okay?
Yeah, for our height, the chairs aren't bad, okay?
Right.
A little bit, you can see, well, in my case, my thighs and my leg isn't quite at 90-degree angle. It's a little bit higher than it should be. We should be a little bit lower so that we get that nice 90-degree angle. But again, it's a custom for the setting and the billiards table.
Yeah, this is slightly higher than normal workstation.
So it's a little bit more elevated than it should be. So there's a little bit extra stress and strain on the hamstrings. I can feel it, but it's not bad. Okay, and I like the position for the back. It lets me be neutral. I would just like the chair to be a little bit lower because we're not quite at that 90-degree angle that we should be. Yeah.
Time to chop their legs, I guess.
So the other thing we could do to kind of alleviate that is we could put something underneath our feet to raise our feet up a little bit to give us that 90-degree angle.
That should be helpful. I think instead of chopping the legs, I think we can have something like a foot or feet support.
Yeah,
right?
you could have foot support. And that would take that stress and strain off the lower back. Because that angle isn't perfect, the lower back extensor muscles and the hamstrings are a little bit tauter. So if you're staying in this position for a prolonged period of time, you're more inclined to get more tone in the muscles and more fatigue in the muscles.
Right. The foot rest should help.
Exactly.
Okay, great. That's something we'll go ahead immediately with. Right. Now, in terms of the ergonomic chairs, you mentioned we should have, this is not certainly ergonomic, right?
It's a director's chair. It's not, it could be more ergonomic if with the footrest underneath it. Yeah. But ideally, you want to have furniture that's tailored to the individual, their type of work that they need to do, the work setting, and the positions they're going to get themselves into.
Before we move on, I have one simple question for you. Are you ready to take on and start your 10x journey? If yes, hit that subscribe button now. Because in every episode, we're diving deeper and deeper into mindset shifts, success strategies, and real stories to help you think bigger and grow faster. Are you in? If yes, subscribe now and let's take this journey together. What is the truth behind ergonomic chairs? There are many, many companies out there. I mean, you go to the office furniture shop, you see many, many varieties of chairs. Which one should choose? And what is the truth behind these?
Yeah, I think any good manufacturer who has a good background in ergonomics makes decent products. However, in larger companies, they actually have ergonomic specialists who can come in and evaluate the particular individual. The trend now in offices, and I recommend, is a variable height desk, okay? Because a portion of the time, the employee can spend standing and seated. And that's great if the patient is working an 8 or 10 hour, 12-hour workday. They can spend a portion of the time standing, a portion of the time seated. I really think that's the evolution of ergonomics now with the variable height tables, where the patient actually reduces their amount of sitting on a daily basis and actually spends a part of their day standing. Yeah.
Right. The sleeping part is very important, of course. You mentioned something about that. Of course, body is not meant to rest for a long time, but here we have to sleep for 7 to 8 hours a day, at night, of course. What is the best posture for sleeping?
Great. So let's make a clear delineation. So the body is meant to rest. Rest is extremely important, especially in back pain, okay? And one of the hallmarks of treating a patient is that you want to reduce their pain sufficiently enough that they're comfortable resting. Because the patient isn't getting proper sleep, can't heal, okay? What my point was we don't want to send a patient to bed
Correct.
for 2 weeks, okay?
Correct.
So as far as sleeping, we want a patient in a neutral spine position, okay? Typically, the best way to sleep is either on their side or on their back, not on their stomach. The stomach is a very stress-filled position for not only the lower back, but the neck. Because if you're sleeping in a prone position on your stomach, as far as your neck, you're going to be breathing into a pillow, okay? Otherwise, you have to turn your head.
Yeah.
If your head is turned either way for 8, 6, 10 hours a day, it puts a lot of undue stress on your neck because it has to be in a rotated position. Ideally, you want that patient in a more neutral position, either on their side or on their back. If they're on their side, it's nice to have a pillow in between their legs or on their back with a pillow underneath their knees.
Right.
And then for their neck, a good rule of thumb that I tell patients is that pillow height should fill in the gap between the tip of the shoulder and the neck, this space, because we want the shoulders and the neck to be perpendicular. We don't want it to be in an obtuse angle or an acute angle where you put undue stress on the neck. We want it to be neutral where that shoulder and the neck are perpendicular to each other.
That is great advice, but how to change the habits, doctor? I mean, it's very tough. I mean, one can hear this podcast and go back and then forget.
Excellent question. And oftentimes, that's one of the first thing that I tell my patients. Easy for me to say, hard for you to do. Any habit takes dedication, willpower, and repetition. It's akin to patients who come in and say, I want to fix my posture, okay? Well, in order to do that, that takes a willingness to change and a desire to change. Just like losing weight, stop smoking, exercise, okay? Because it's not enough for me to say it. I cannot make you do something. You have to have that desire and willingness to change. And then I can provide the guidance to do that, but it's up to you or up to the patient to actually execute that. So one of the things that I tell patients to do, for example, when they're a tummy sleeper, is I tell them to get a large pillow or even a pregnancy pillow, okay? Because they can throw their leg over that pillow and the body instinctively knows or gauges that something is there blocking you from turning over onto your stomach. And that's a very useful tool to help learn how to change your sleeping habit. But you're right, there's no easy journey. There's no easy journey to losing weight, and there's no easy journey to exercise or to stop smoking.
Yeah, you mentioned something about pregnancy, of course, a pregnancy pillow, but I'll connect the dots here. Talking about pregnancy, a lot of pregnant women, according to studies, about 50% of the female, of course, during their pregnancy, go through some sort of back pain. How do you help them?
Great question. So I'm fortunate enough that some of my patients are actually OBGYNs, and they have referred me their patients. So, and going back we're talking about back pain, okay, and common causes of back pain. So pregnant females experience mechanical back pain. The majority of times, their back pain is associated with their pregnancy, the expansion of the uterus, the growing baby inside of them, the misalignment of their pelvis. So chiropractic happens to be one of the best and safest types of treatments for pregnant women for back pain. Why? Because it's drugless, hands-on, manual type of treatment with very low risks. So we are fortunate enough to see a lot of pregnant females. Addressing the mechanics, the alignment of the pelvis reduces the pressure on the spine, the overworking of the muscles and the ligaments. The mechanics of pregnancy entirely changes how that woman's body moves. And chiropractic is one of the best ways to address those movement disorders for that 40 weeks or 9 months that patient is pregnant.
But they do see results, I guess. And just like a normal person.
Yeah. So again, we treat the options for pregnant females as far as treatment for their back pain are extremely limited. You don't want to give them medication while they're pregnant. Obviously, you don't want to subject them to imaging such as x-rays and things like that. You don't want to do anything invasive that may harm them or the baby. So yes, chiropractic is a natural and holistic solution to treating that pregnant female's back pain.
Right. The reason I asked that question was that, during pregnancy, the weight of the baby is increasing, right?
Yeah.
The cause for the pain is perhaps increasing, but in chiropractic, discipline, you adjust the spine, but this adjustment could potentially not last long because of the increasing weight of the baby.
Yeah, I mean, pregnancy is a dynamic thing. It's ongoing and changing, okay? And what, again, we seek to do in any patient is to normalize their function, to introduce things that will help them, such as exercise. And one of the things that I always recommend for my pregnant females is stabilization exercises, pelvic tilting, things to work with their pelvic stability. These are things that are going to help because that pregnancy, as it progresses, gets that woman's body ready to birth the baby. So in the later trimesters of pregnancy, we see hormones that are secreted in the body to open up the pelvis to allow that baby to drop down and go through the birth canal. So that works on the ligaments of the pelvis to loosen things up. So it's very important for the patient to do some ongoing exercises to help to maintain the relationship. Yeah. And you're right. Yeah. More often than not, that pregnant female is going to need some sort of ongoing care throughout the pregnancy.
Right. That makes a lot of sense. I mean, medication is kind of prohibited during this time, and only natural remedy could potentially be chiropractic solutions. Right. Tech neck is another area where we're seeing a lot of rise in the neck pain around the world because of the use of devices. And of course, the younger generations are heavily dependent on the use of gadgets, iPads and mobile phones. And in our generation, of course, a lot of work is done on mobiles. And we are, as a overall, I think, world population, we're bending a little too much, I think, in terms of our posture. And I was doing some research. The neck pain caused because of the use of tech is going to increase in the coming years.
So again, going back to our conversation, overuse, misuse, unaccustomed use. Tech neck, trigger thumb, carpal tunnel syndrome. These are all work-related or overuse or repetitive, what we call now RSI, repetitive stress or strain injury. Doing the same thing day in and day out has a cumulative effect. It's like filling a glass, okay? If you have a leak or you put a bucket down, slowly that bucket gets filled until one time that drip comes down and then that bucket starts to overflow and become symptomatic.
Right. That's where you come to realize that you've been doing this or that,
Too late, yeah. Now it's time to treat it and say, what do I need to do to fix it?
Right. How can we avoid the tech neck?
Yeah. So again, going back to the ergonomics, from the start. We need, when we're using that phone or that mobile, we need to have that at eye level. When we're using a laptop, having a laptop stand, okay, as opposed to down like this on a repetitive basis. Very, very useful. Having a keyboard stand where the keyboard is in a more sound position, okay? Taking a break. I hear this very, very often when I interview patients. They're working 8 or 10, 12 hours at the same thing. Well, are you taking a break? No, I can't take a break. You need to take a break. You need to take that few minutes to readjust your position. Go get some water, hydrate, make sure your position. It's just that little care and effort that you need to take, that little bit of consciousness or awareness that you need to do that will help prevent these conditions. The best analysis I can give you is like taking care of your car, okay? Bring it in every so often to change the oil, to realign the tires, to realign the front end. Well, shouldn't you do that for your frame? Of course. But a lot of people get too busy in their lives, too wrapped up in the Dubai work ethic, that we forget about this and put ourselves secondly.
Yeah, the important thing here is that this body frame is the only body frame that we're given in this life.
Exactly.
In terms of the car, you can change the car, you can change the model, but unfortunately, this is the only body that you're given.
It's the only one you get, right? So you need to take care of it as best you can. And what we have to remember is, unfortunately, as soon as we're born, we start to age. And as we start to age, that is a wearing process. Now, how fast we wear is dependent on multiple factors: genetics, external factors, internal factors, nutrition, environment, all of this, okay? But the overall trend is a downward cycle. So as you said, Tariq, it's the only one we have. We need to take care of it so it lasts as long as it possibly can.
Absolutely. It has to be done with the intention, right? I mean, the awareness is very important, which we are creating, I guess, for ourselves. Myself, I mean, I'm getting educated here, but until I decide that I'm going to do this or that in terms of correcting my posture, nothing is going to change.
Awesome observation. And one of the things that I always ask a patient when they come in is, what are your goals for care? Because if the goals for care aren't aligned between practitioner and patient, then that patient isn't going to be satisfied and the results aren't going to be achieved. For example, if a patient comes in and tells me, no, doc, the only reason I'm here is I just want to get out of pain and then I want to go back to my life, then we know that there is little point in trying to educate or correct the patient for long-term stabilization because that's not in their goal alignment. So they're going to be hesitant or resistant to change. Now, we can introduce that idea and kind of sprinkle the seeds, but if the patient truly isn't aligned with that as a goal, they're not going to succeed in that type of care. That's why it's very important to align expectations between healthcare practitioner and patient.
I keep cracking my fingers all day. Is that something I should stop?
It's more than not a habit. It's a nervous habit. There's not going to be any negative effects to doing that. However, I would have you refrain from doing that to your neck, particularly. There's a lot of sensitive hardware in the neck, particularly vessels and nerves. They're actually, if you believe it or not, you can cause some significant damage to your neck by doing bad things. I like to tell patients you would not necessarily pull your own teeth, so don't crack your own neck. Not a great idea. You can do some simple ranges of motion, and if you hear a cavitation or a click or a pop, that's fine. But I would not do anything excessively overuse in your neck area.
Which areas of the body can I actually crack with your permission, apart from the fingers?
Yeah, I mean, mobilize. You can mobilize your entire body, okay, by doing some gentle stretching, yoga. I much prefer this as opposed to anything else, okay? Just simple ranges of motion exercises or yoga, that's certainly more than enough.
I think this is a message for the audience. And of course, they're getting so many tips here. But the most important thing here is to be self-aware and have that intention that you're not going to let your lifestyle destroy your body. Because this is the only body that we have gotten during this lifetime. So very important message from Dr. Gerry here. Very, very important thing for you to understand yourself, be self-aware and have that intention to fix yourself, fix your mind here before you move away from this podcast, by the way.
Yeah, so an interesting point, and to give you an example, is a lot of times when a patient comes in and wants to fix their posture, one of the basic things I introduce them to is a postural exercise that I ask them to spend 15 seconds 5 times a day to do. Not a huge commitment, 75 seconds a day. And when they come in after a few days or a week, and I ask them, have you done your exercise? And they say, I was only able to do it once or twice a day. Again, it's very difficult to make a postural correction if a patient isn't going to invest at least that 75 seconds a day. Yeah?
Dr. Gerry, we're prisoners of our own habits.
Yes.
I was given some exercises when I saw a physiotherapist. We'll talk about that physiotherapy separately, but I was asked to do certain exercises. Our lifestyles are such that we're busy at work. When we go home, children are waiting. If you have children, if you have a spouse, they're waiting, or she or he is waiting at home. Life is so hectic that, to find even those 2 minutes becomes a real challenge.
Absolutely. That's why they say motivation isn't enough. Discipline
is the key.
Is the key, right? Yes. You can be motivated, but if you do not have the self-discipline to execute, then that motivation is wasted, right? And that goes, as you know, you're a business, and that goes with anything in life, okay? You could be the most motivated individual, but if you don't have that self-discipline to execute, then it doesn't get accomplished.
Absolutely agreed on that. Now, talking about physiotherapy, someone has a back pain. How should one decide whether to opt for physiotherapy, go for the conventional medicine, or come to you?
Great question. So in my experience and practice, we utilize both, okay? And to give you the best example is how chiropractors and physical therapists work together or should work together is like this. So we're part of that healthcare team. So chiropractors are the structural engineers, okay? We're concerned about the framework, the balance, the function. And physical therapists are like the construction team. They're concerned with the strengthening, the stability, the execution. So in my particular practice, we utilize them together. So, and one of the things that I see in practice is why patients fail who have back pain, who've only seen a physical therapist, is this. So if you have a car and the car is out of alignment and you fix it, okay, and you haven't fixed the alignment, you can still drive the car, but you're not getting that optimal ride because the alignment is off, that balance is off. So a lot of times when I see a patient who's gone to physical therapy and they've gone through a strengthening program and they're still having their symptoms, it's generally because that balance or that function wasn't optimized before the relationship was strengthened. And if you strengthen that relationship in an aberrant functional relationship, then it's not optimal and you don't get the results.
Right. The way I understand this is that you have to strengthen your muscles and you can align the spine, but without strengthening the muscles, it won't work.
Yeah, that's why I said hand in hand. It kind of goes together, okay? But you need a functioning, optimal relationship to reinforce as opposed to a dysfunctional motion relationship. If you reinforce a dysfunctional motion relationship, then you've reinforced a negative situation as opposed to a positive one. So that's why it's very important to make sure the joint function is optimized before you strengthen. That's why we talked about a little bit ago about the phases of care. So we move from phases of care from acute to strengthening and stabilization to rehabilitation. We don't start off with strengthening and stabilization before we move out of that acute phase, okay? And it's going to take time for us to move out of that acute phase to go into the strengthening and stabilization phase. And when we have a situation that's chronic, that's gone on for a long time, we already know those mechanics aren't right. So we have to re-educate the motor system to a more proper functioning system and then re-strengthen and re-stabilize into that proper functioning system.
Right. When do you say that you're not able to fix someone?
I don't like the word fix, okay? Fix implies, that's like asking or akin to saying, my GP fixed my cold, okay? Yeah? So what I like is, I don't like to imply cure, okay? I like to have a patient address their situation because I deal with mechanical problems. Mechanical problems have a tendency to reoccur based on a variety of things. The number one thing could be overuse, it could be re-injury, it could be for a variety of reasons. The patient can have back pain, but that etiology of the back pain could come from many different sources, okay? So what my goal with a patient is to release a patient into a situation that they don't need to rely on me, okay? Where we've educated the patient to the level, to the extent that they're able to take care of themselves 95% of the time without my intervention. Just like in that patient who, God forbid, they get sick, they take care of themselves, and in a week or 2 weeks, they're better on their own.
Right.
Provide them, educate them, give them what they need to do.
In what cases would you recommend a surgery?
Great question. So in the lumbar spine, there are 3 typical reasons that a patient should have disc surgery, okay? And let me point out that the majority of lumbar disc herniations do not require surgery. Studies show only between 94 to 96, only between 4 and 6% of lumbar discs truly need surgery. 94 to 96% of discs don't require surgery. There are 3 main reasons a patient should consider disc surgery in their lumbar spine. Number 1 is 10 out of 10 pain. That patient can get no rest. They are not comfortable with medication or any traditional means of reducing pain. They are just simply not they can't get out of pain over a sustained period of time, a week, 10 days. They just can't get comfortable. Number 2 is they have significant neurological dysfunction. By that, I mean they have control loss of their bladder or bowel. They have trouble controlling their urine or stool. This is a neurosurgical emergency. It needs to be dealt with right away. There's no way to wait on that. It's off to the surgeon right away. Or they have progressive, significant weakness, meaning a loss of strength in their arms or legs, hands or fingers or feet, where they may develop a foot drop. Their foot is flopping on the floor. They're unable to grip or hold the pencil, or they have progressive weakness, something that's rapidly deteriorated. Or the third situation where everything else has failed. They've exhausted a reasonable trial of conservative measures over the course of about 6 weeks. If a patient has failed conservative measures for 6, 8 weeks, has made no substantial improvement, then potentially a surgery is required.
Right. In those cases, you have doctors who you refer the patients to, I believe.
Yeah. So in my practice, I have a select group of 3 or 4 orthopedic spine surgeons, neurospine surgeons that I have developed a relationship with over the course of the last 16 years here in Dubai. They, the mark of a good surgeon, and I always tell a patient this, the mark of a good surgeon is they always want to do surgery last. Surgery is the last best option, because once a surgery is done, it can't be undone. And one of the misconceptions that I have and I educate patients with is once a surgery is done, and I'll go back to what you used, Tariq, fixed. There's no fix, okay? What a disc surgery does is it removes the offending piece of material that presses on the nerve. And then the surgeon packs the area up and we hope for the body to heal. And I see patients post-surgically all the time, okay? Because post-surgical rehab is extremely important, sometimes even more important than before surgery. What the patient has to understand is that disc material can come out further if that material, if that area isn't healed. So all that surgeon does is remove that offending piece of material that's on the nerve that's creating the pressure. Okay, right. It doesn't mean you get a new disc. It doesn't mean that disc is sewn up. Yeah,
right. It's just removing the part that is touching the nerve.
Exactly, it was compressing.
But in my case, I mean, I was advised surgery. I didn't meet those 3 conditions that you mentioned. I was still advised surgery. I don't know why.
It's difficult to comment, and I reserve my.
Of course,
I cannot comment on that.
Comment, and I wouldn't expect that. Yeah. But the other doctors had said that I need to continue with the swimming. I did the swimming, and eventually it got fixed using the same language again. But of course, the recurring is another thing. If once you have a certain issue, it might come back to haunt you. Yes. So taking care of your spine, fixing your posture, and taking care of the entire environment around you, in terms of the chairs, the sleeping posture, the walking, if you can swimming, and all of those things I think should be taken into account by any individual. We shouldn't be looking at these things once we are facing this issue.
Sure. I mean, you have to understand that lower back pain and neck pain, these are situations, they are medical conditions akin, granted, they're mechanical conditions as opposed to visceral conditions like diabetes or hypertension, but their management is no less important. So if you have a patient who's hypertensive or diabetic, even though they may not necessarily be symptomatic, there's ongoing management that needs to be done to control that condition. Just like there's ongoing management that needs to be done to control that mechanical medical condition.
Absolutely. In condition number 1, you'd said that the pain, 10 out of 10. Of course, I'm assuming that this is 10 out of 10 after the use of the medicine. For example, you typically given, anti-inflammatories and, medicine to calm your nerves and all that, So I guess you're talking about the pain.
I'm talking 10 out of 10 pain that is not well controlled, okay?
Right.
Whether it be from injection, anti-inflammatories, or stronger pain medications.
Right.
If a patient simply can't get comfortable and get that rest that we were talking about, that puts them in a different tick box, okay?
Do you prescribe medicine?
Great question. So as a chiropractor, we can recommend over the counter here in the UAE, but no, I do not typically prescribe prescription medication.
Right. So I can relate to, again, on a separate note, the mental trauma that I went through at the time when I had this slip disc 13 years ago. When I couldn't walk straight, I started having, issues in terms of the mental health issues. I felt very demotivated. I felt that this was the end of the world for me. I thought there was no future for me because, walking is one ability that you'd want to have throughout your life. Not only walking, you should be able to run and, do your daily stuff, whatever you want to do. So I went through hell, actually, during those 6 months. Thankfully, I came out of it, but I'm sure back pain, at the moment, it's causing some issues right here at the moment, but it's manageable. But I'm sure a lot of people around the world go through back issues and they go through management of their mental health at the same time. How do you support patients with that?
That's a great question. And today in healthcare, the quiet elephant in the room is what's called biopsychosocial. Okay, the biopsychosocial element of any health condition, or particularly back or neck pain that I deal with, is a huge component. Because the scenario that you're describing, the fear, the catastrophizing, these are huge elements to address with the patient, and oftentimes can overshadow the mechanical aspects of it. So what we have to do and remember, and that's one of the things that I love about chiropractic, because chiropractic addresses the whole person, okay? Just not a component part, like a cardiologist looks at the cardiovascular system, or a dermatologist looks at the skin, the integumentary system. I look at the whole picture and how that affects it. Remember, the spinal cord houses that central nervous system, and the brain's involvement and in pain syndromes is very, very important to address, because when a patient is feeling better, their serotonin levels are higher, okay? So their depression or their ability to contain their depression or their anxiety is better. So what we have to do is give those patients the outlet, the tools to teach them how to deal with their symptoms on a day-to-day basis. We give them little milestones, things to accomplish. Geez, I can't walk for 15 minutes. Okay, let's go out and walk for 5 minutes. Let's see how that goes. Let's get out of bed today and let's start moving around. You can do it. You're not going to hurt yourself by getting out of bed. The body was meant to move, meant to walk. And if you can start to put that patient on the right course, or introduce them to some biofeedback mechanisms, this is going to help address the biopsychosocial of that patient's illness.
Mm-hmm. Absolutely. And do you have any client stories going through this kind of a situation, and you helping them successfully?
Yeah, I mean,
in terms of the psychological.
Yeah, I mean,
issues.
every day with these patients that we set these small goals. And I had a patient who initially came in and suffered from a condition that's called neurogenic claudication, which means they have numbness and tingling in their leg, and they weren't able to get out of bed. They just didn't want to get out of bed and walk. And when they did, it was just a struggle to go to the bathroom. And one of the real embarrassments that they had was that they had to have assistance to go to the toilet, to go and do this. And we treated this patient and got them to just work on little goals. So by the end of that 2-week period, they were able to get out of bed and go on their own to the toilet, and just give them the little goals of where, this is what I want you to do today. I want you to sit up for just a few minutes. This is what I want you to do today. I want you to try to stand up on your own. This is what I want you to do today. I want you to just take a few steps and just give them really doable things to accomplish. And they are able to put step 1, step 2, step 3 together. And by the end of the line, really helping them to accomplish the goals puts them in a different mindset. You know what? I can do this. I am going to get better. It may take time, but I'm going to get out of this. And it really puts them in a more positive frame of light.
I think that's quite helpful. Now, what is one piece of advice that you'd give to anyone around the world in terms of taking care of their back?
Move. You're not going to hurt yourself by getting up and walking. Yeah. Walk is, you were meant to move. It's a basic function. Even though you may have pain is a warning sign. It's sneaky. It's always the last thing to show up. It's always the first thing to go away. And the body was meant to be in motion. When you stop moving, bad things happen.
The least you can do is walk.
Yes.
If you're exercising or taking care of yourself in terms of, having some sort of daily regime for exercise, that would be great. But at least walking should help.
Yes.
And I guess to top it with the correction of the posture, that'll be quite helpful. I think that's a great piece of advice, Dr. Gerry. Thank you so much for joining me today.
My pleasure.
It's been very, very helpful. I'm sure our audience would take away a lot of information and have that intent to apply the corrections in their lives, just because and only because we have only one body to take care of in our lives. And that's the only body we're given for the rest of our lives. Thank you so much, Dr.
Thank you.
Thank you.
I enjoyed it.
Me too, thoroughly. Thank you. I created Think and Grow 10X because I believe that everyone has the potential to break through barriers and to achieve extraordinary success. If this video today brought you closer to your goals, then give it a like and share it with someone who's ready to take their journey of growth. Until next time, keep believing, keep thinking, and keep growing 10X.